most amazing guest. I am thrilled and I am humbled that she gave me the time. She definitely gives back, and I appreciate that.
Thank you.
She is a board certified medical doctor. She is a key. She's big time. That's all we've got to say. A KOL. She's a KOL, and most of you know what. Most of you know what that is. She also is an entrepreneur. She owns multiple practices, and she is a functional doctor and practices that way, and an aesthetic injector. And what's amazing about her is she's found a way to merge the two together, bringing in regenerative medicine into the aesthetics world without jumping on it, making it not make sense, because it cannot make sense. So today, before I hand it over to her, I'm going to tell you guys, I've got my list today because she's a heavy hitter. We got a lot to talk about. And so today, if you're going to listen to the whole podcast, which you should, there's going to be some things we're going to cover. Today, we're going to cover social media and the impact that that's had on our industry in aesthetics, regenerative medicine, and functional medicine, especially since the GLP-1s have come out. Ozempic, for those of you that don't know that. The decline in the injectable numbers globally. Is that really happening? Is that not? We're going to talk about what's trending, and we're going to find out from her, because her being a KOL, she would have some insight about this. She is also an international speaker, so that's how she's going to get a lot of that information. We're going to talk about innovative treatments like exosomes and stem cells and where that stands, and hair loss and what we can do with that. With utilization of exosomes, and PRFM, the differences. We are going to talk about functional medicine, the GLP-1s, and we are also going to talk about all things buzzing, Sculptra, and Radius. Which one do you pick? Well, there is a difference, and we're going to make sure you explain it to us.
Absolutely.
And in conclusion, we're going to give each other a big hug and a toast to champagne.
Awesome.
Sound good?
Sounds
great. But
great.
here's what we're going to do first. I would like to know about you, and I want you to go way back. I want you to go what got you interested in medicine, high school even. Where was your focus? Where you grew up? Take us on a journey, and you can talk about it forever. I'd love to hear it.
Oh, well, thank you, Jory. Thank you for that great, fantastic introduction. So a little bit about my background in growing up. So my family is pretty much mixed as far as business, engineering, and medicine. And I actually early on was very more into the arts and also into sculpting and painting and the arts world. And it was very interesting because my parents were like, oh, is that what you're going to do, or so forth. Then I actually took a big interest in science, and that's where the medicine part came in. And I was like, oh, okay, let me see and dabble and see what I was interested in and all of that. And I had traveled a lot with my parents growing up, so I was already exposed to a lot of international travels, which I did love. Then when I got through high school and then into college, and then at that point I decided, okay, do I want to be a doctor? Do I want to be a lawyer? Do I want to be an engineer? And then I was like, I really want to take care of people because I always was very nurturing. I also was more kind of like, in life we have either you're a caretaker as a giver or taker. And I was always pretty much more into the taking care of others.
Were you an only child, Aza,
No,
or did you
I'm
have
actually
siblings?
the youngest. I have siblings, but I'm the youngest.
Oh, and you're a caretaker.
Yeah.
You've got that caretaker mentality as a baby.
Yes.
Oh.
And it was very interesting because I was also very big into, taking care of, strays and animals, and also being involved with children charities and nurturing. And that was one of the reasons, too, when I decided, okay, what specialty am I going to go into? And one of the big things for me is I get bored easily. I am a very type A, OCD type of personality, and everybody that knows me, and I'm not embarrassed to share that. I guess it's the tourist in me, as they say. So I was just like, you know what? I think I'm going to go into anesthesiology. Why? People ask me, did you go into anesthesia? Why not primary care? Why not pediatrics? Why not internal medicine? Why not plastic surgery? And I was just like, anesthesia encompasses pretty much, you have to know pathophysiology, pharmacology, everything. So we're the gatekeepers for surgery because we have to make sure that even though the patients get cleared by the primary or the cardiologist, we have to make sure that the patient is up to par to have the actual surgical procedure. So this is where I was like, you know what? This is a specialty that I actually want to go into because it encompasses all the different sciences. I have to know pathophysiology, head to toe, anatomy, you name it. And then I also did a master in science actually in pharmacology. And this is when I said, okay, I'm going to be an anesthesiologist. I don't want to be just putting people to sleep and waking them up. What do I really want to do? And that's where I also did a fellowship in critical care trauma. So I did all my training at Northwestern University in Chicago. And I also did a research fellowship in pharmacokinetics, pharmacodynamics. And then I did critical care trauma, which was great adrenaline surge. Loved it. Life and death.
You must have struggled in school, I take it. That's a tough one. You are a smarty pants. I love it.
The thing is, I think that was most struggling is that, unfortunately, and I don't like to play that card or whatever as like the female. Oh my God. But yeah, female versus male in the world of medicine, especially critical care and trauma and all that was challenging, but I enjoyed it and I enjoyed the challenge. So, and then I also did pediatrics. So and then I also did pain management. And once I got done with all of that, this is when I also then moved to Florida. And when I moved to Florida, and also because of family and other things too, and businesses and entrepreneurship and all that, I was just like, okay, what do I really want to do? So I got involved, obviously, with the different healthcare system. I became a national director for a healthcare company, did hospital startups around the country. So the admin side, that I learned.
This is all before aesthetics.
Yes. Oh, yeah.
Okay.
This is all before aesthetics. And I was just like into the multitasking, the business management, because like I said, my dad and my family and all of that. So I did all of that, found that interesting, still managed to be a practicing physician, being in the administrative side of like healthcare. And then I was just like, you know what, there's more to medicine than just being in the OR and just traditional medicine. This is when I took an interest in functional. So I actually started a little different than most people that are doing aesthetics now. Everyone that started aesthetics is now trying to get into the bandwagon of regenerative functional. I started with the functional medicine world, and I was very fortunate to have the greatest mentors in the space, actually. And I learned a lot. And then I was like, you know what? I can blend traditional medicine with regenerative functional medicine in order to find real solutions and treatments for patients. Because if you don't find what the actual underlying diagnosis is, you're just putting a Band-Aid on the situation. Once I was doing all of that and I was seeing the difference by incorporating the two, and it was funny, so some of my colleagues that are plastics and derms, they said to me one day, why aren't you doing aesthetics? And to me, I was like, Botox fillers, that's not challenging. And they're like, but you deal with life and death. I'm like, yeah, I know, but I want to be able to do something more than just do Botox filler. So I decided to dilly-dally a little bit with some of the aesthetics.
What year was this when you got into functional? Were you one of the early
long
people? Yeah? Long time, huh?
Yeah.
Were you doing hormone therapy?
Hormones, all the regenerative stuff, trying to figure out what is going to work for people. Even like nowadays, we know all about peptides, but back then also peptides were still
They've been around forever.
Correct.
We're trying to pretend like these have been around something new. They're not.
And also the thing is that, A4M has been around for a very long time. And A4M, they've had the godfathers of everything from hormones to peptides to you name it. So I learned a lot from them. And then there was IFM. So there was a lot of information to take in, and I found it very interesting, especially having a pharmacology background. I did also a research fellowship in pharmacokinetics, pharmacodynamics in Northwestern. So I was like, you know what? I can bring all that in together. I got into aesthetics, took all my trainings with like the best in the industry with plastics and derms, learned a lot about that. I have a lot of my best friends are plastics and derms. Also, I did a lot of preceptorships, just shadowed people, learned a lot of things. Then I was like, you know what? People need to actually feel good on the inside and look and feel good on the outside. The two need to go together. You can't separate the two. And this is where I was like, you know what? I think I can integrate aesthetics with my functional regenerative medicine. And
Were you getting questions from your
colleagues?
Yeah, well, from your patients.
Yes.
Were they asking you, well, what about, would you do my Botox? What do you think about that? Is that toxic to my body? Were you getting all that?
Yes, absolutely. And of course, we still have a set number of patients that come in and they want the all-natural or the holistic approach. And then we have others that they don't. And you know what? It's good to be able to offer people the best of both worlds, and yet also to give them options, okay? Now, what I like to do, because I'm very into education, as you said, as a KOL, I like to be a mentor, I like to be a key opinion leader, and also I do speak nationally and internationally, and staying ahead of the curve. So for me, educating the patients is one thing, and then also teaching and training my colleagues and peers is another. So those are two different worlds. And when you are trying to educate your patients and clients, you do have to speak their language and you have to make sense of it for them, right? You can't expect them to understand our language in the medical healthcare world, right? That's almost like you giving somebody a medical diagnosis in the hospital and then they're looking at you like, okay, so doctor, what was the prognosis? What does that mean? And you walk away from them. Okay, that's not ideal. It's not going to help your patients. So this is the reason I also feel education is important. I've been very passionate about it for both patients and colleagues. So I started incorporating, integrating the aesthetics with the functional, regenerative. And it's very interesting that I see that now a lot of people are trying to figure out how to incorporate the regenerative integrator with the aesthetics.
Yeah, that's an issue. I think that that could be an issue. And so I think my personal opinion is what's what I love about you so much is that you're so willing to help with that education and bridge that gap. People are reaching for information, education, and courses, but this is stuff that you can't learn in a weekend seminar.
No, absolutely not. And like when people ask me, oh, how do I get all that information? I'm like, okay, I didn't roll out of bed one day to be claiming to be an expert. This has been years of cumulative knowledge, education, putting the time in, spending the money to go learn from the best and getting mentored by the best in the industry. And then also cultivating your own other protocols, and being involved with trials and working with other people in order to share knowledge, ask questions, and also develop. Like, I do have also my own trademark treatments and procedures that I created in order to try to tackle issues that are not easily resolved by, oh yeah, just go have surgery. Or, oh yeah, just take, yes, exactly. Or just go take the supplement or just go take that cream and, it's a magic wand. I tell my patients this all the time. I wish I had a magic wand, but I don't. And one of the biggest things I tell everybody, you have to have realistic goals, expectations. We as providers and physicians and practitioners have to also give our patients set realistic goals, right?
Yes.
Because you cannot promise them the sun and the moon and the stars and not deliver it. And I think this is part of the problem that we are seeing and we are having. And I think this is part of the problem where the trend happened where people were overpromised and underdelivered on results when it came to aesthetics and, oh, let's just put more filler and more filler and more filler. And I have seen that because I had patients come to me from other practices and I look at them and I'm like, okay, we need to dissolve this. And they're unhappy with with how they look.
It's like taking their Mercedes away they just bought.
But they actually,
get rid of it.
Right. But then some of them will be like, I just feel like now my face is too full. It's too round. And I'm just like, well, why don't you go back to the original person and just have them dissolve it? Well, and then the response from one of them was like, well, I did. And he decided to put more fillers. And I'm like, okay, but you should have said no. And that's not what you wanted because that's not going to fix the problem. So I feel bad because also I'm like, oh my God, they spent all this money on fillers and now I'm going to take it all out and dissolve it. And they're going to have to spend more money to fix the problem, which is why I try to encourage them to go back to the original office to see if the office can help remedy the situation.
You're kind to even see somebody with, a lot of people won't touch other people's, other providers' mistakes or not even mistakes, an unhappy patient.
Right.
So that's, we need more of that because that would be helpful because then we can begin educating patients a little bit more.
And I think we in the industry need to also work together rather against each other. I think we all need to be respectful of each other. This is something that sometimes I get a little bit disappointed because, number one, this is not a competition, okay? We are all going to do just fine. You're going to have your patients. You're going to have your patients. I'm going to have my patients. There's plenty for everybody. You just need to do the proper work. You need to be genuine and sincere in how and what you're doing for your patients and also understand your limitations. One thing I tell people when I'm training and educating, it's best to stay in your lane, understand your limitations, and don't feel shy about the fact of reaching out to another colleague. So for example, if you're an expert in something that I don't know, I'm going to reach out to you or I'm going to send my patients to you. And this is where I do have a lot of respect for some of my colleagues because I do have patients that come in and I always ask, oh, who referred you or who sent you over? Because, my patient clientele has been literally by word of mouth. I've never done really any digital marketing, okay? And I've been fortunate enough.
Yeah.
Okay.
We were early days, girl. We didn't need that.
It was word of mouth, networking. People found out and knew about you. And now with social media, which we'll get to, but they'll say to me, oh, well, so-and-so sent me to you. And I'm like, but I trained so-and-so. Why aren't they treating you? And they're like, oh, well, they said, oh, if you want to go to the best, or they feel more comfortable if you just did it. And I'm like, okay, well, at least that was honest, sincere,
That's
genuine.
honest.
So I pick up the phone, call them, and say, thank you for the referral, but, I want you to be comfortable. If I trained you, you should be doing this.
Yeah, right. Pick up the phone and call me. I think that could be something that we need to push a lot, to not be afraid of each other.
Right.
And to be a team.
Right. No bad mouthing, no backbiting, right. No competition.
No.
Right.
Working together, giving back. There's enough for all of us. And we're really got, like you said, you were a nurturer. You got into this for patient care and to elevate and to heal. And that's what we're still trying to do, even through aesthetics, of course, through functional medicine especially.
Absolutely.
But aesthetics is still a world where we should really, it's about uplifting and elevating and being able to actually diagnose people with we've seeing other things like body dysmorphias, and we're having other things. We need to be educated as providers on that and how to recognize it. So I think that's amazing that you're doing that. Before we move on, I want to know, did you ever fall in love? Did you have a love in your life? A special love you want to share?
Yeah. I mean, I've been married and divorced.
Okay. Oh, there you go. That's all. We just married and divorced. There's the story.
We've all been there, done that, right? What can I say?
Cupid's bow hasn't recently spiked you.
No, not recently.
I bet you there's lots of interested males out there, though, or females, either or. We don't know. That's amazing. You've got an amazing story. I knew you did. I wanted to hear it from you. And you reside mainly in Florida. That's your home base.
Yeah. So, like I said, originally I'm from Chicago. I mean, I grew up in New York, but then I moved to Chicago, and then I moved to Florida. So Florida is considered my home base pretty much. And then I do travel and commute between Chicago, Florida, and California.
She has practices in all three of those locations. Plus, she speaks, treats patients. So you're busy.
I try to stay busy.
Yeah, it's her type A. It's your type A.
Yes.
And it's just how you're wired.
Yeah.
And it's what makes you full and happy. And that's why you dance back and forth between treating patients and then educating. It fills your heart, and you go back and you treat patients, and then that fills your heart, and you move on to the next. So
I mean, I always love a challenge.
Yeah.
I also love innovation. I love growth. I like to see change. That's one of the things, like I said, I think the world of anesthesia, it depends how you look at it. Some people think, oh, you just put patients to sleep and wake them up. I'm like, no, there's more to it than that, especially when you're a critical care trauma intensivist, okay? And also that's the other thing too, like when I was at Northwestern, we had the spinal cord unit, which was the spinal cord unit for the Midwest. So I took care of a lot of really ill patients that unfortunately had unfortunate accidents of all ages, from 12 years old on up. So, these children and these adults, their life is literally gone right before them. And now they have to learn a whole new way of coping. So you do learn a lot from the physical, the mental, and the psychological standpoint. And I think for me, the functional regenerative has also been great, especially because of the fact that also, if you think about it, there are now, especially once we get into like peptides and we get into proper nutrition and supplements and so forth. And I know, of course, the big question that everyone asks, well, what's FDA, not FDA? And this is why I tell everybody, listen, you need to know the rules, regulations, and guidelines of the FDA. You need to stay within that. You need to stay up on top of the literature. What is considered FDA approved versus cleared versus also on label, off label, and if it is even on label or off label. A lot of people, unfortunately, I've realized sometimes don't know how to differentiate the two. And this is where bad press comes out, bad information, and then it gets spread all through media and IG, and then it sends everybody into a frenzy and into a panic, which is not good for the patients or for our industry.
No. And I'm just going to jump to that topic right now because we're going to talk about stem cells and polynucleotides, exosomes. Some stuff's FDA approved for topical, and some of the exosomes. Let's talk about exosomes. I'll let you explain it because you can so brilliantly do it. To differentiate between what is allowed to be used, FDA approved here in the States.
So when it comes to the topic of exosomes, which is a great topic, it's a great buzzword, okay? And some people don't even know what
It's
an
a
exosome
buzzword.
Right.
They don't know
Right.
what it is. Yeah.
I mean, now all of a sudden everything's an exosome, okay? And this is where also now the FDA has to be involved, right? Because there are certain claims that are being made. And we know that according to the FDA, you should not be making a claim of diagnosis or treatment unless it is FDA approved, whether it's a medication, a pharmaceutical, or anything that you are actually delivering to your patients. We as physicians have to abide by that law. When the word exosomes came out, because what is it? It is a messenger, carrier, communicator, cell to cell. Now, you can get exosomes from your own cells. You can get exosomes from plants. You can get exosomes from placenta. You can get it from umbilical cord, which is the Wharton's jelly. You can get it from a lot of things, platelets too. The big problem that I think we're seeing in the industry is that everyone got on the bandwagon for commercial reasons, right? And called everything an exosome. And this is where it confused a lot of people. Now, in the United States, exosomes are not FDA approved yet. This is where trials and studies...
No, that's right.
Right?
Yes.
Trials and studies have to be done and are being done in order for the FDA, before you go through the phases and to get to the phase 3 trial stage, in order for anything to be FDA approved. Now, if you go outside of the United States, they've been doing trials and studies with stem cells, exosomes, and you name it, okay? So the question is, when people say, well, yeah, but they're using this in Europe. Well, yeah, but you don't live in Europe. Just like when people say, oh, I get my Botox cheaper in Canada. Yeah, but you can't buy it in Canada and bring it to the USA, okay? You have
There's rules.
Go move to Canada.
Yeah.
I always tell them, okay? So the thing is that with the exosomes, like I just said, there are exosomes that are plant-based versus human-based, okay? So this is where the differentiator comes in. Now, you also have to understand the sourcing of the exosomes. You have to understand the testing, also the sterility, and the production and manufacturing of the exosomes. And this is why when you hear people...
false claims in this.
Correct. And you hear people saying, oh, but I use exosomes and I got Wharton's jelly or whatever. And I think the FDA just recently said something about the Wharton's jelly. I know a warning letter went out to people that were using the Wharton's jelly. And it shocks me when I have heard that people actually are injecting Wharton's jelly IV. And I'm like, you do know that it does have E. coli in it unless there's a certain filtration method. And people don't seem to understand that. So you definitely don't want to be doing that. That's number one. So number two, are stem cells approved? That's compared to exosomes. So stem cells back in the day, those also were not FDA approved. And it wasn't until then when the FDA came out and said if it's autologous and it is not manipulated. And what does autologous means? It's your own, coming from you, okay? So it's not allogeneic, it's autologous. So you can literally take your own fat, harvest your own stem cells, and this is where you do fat grafting in the world of cosmetics and plastic surgery, and go ahead and deliver your own stem cells. That is okay. Same thing if you're doing bone marrow aspirate. That's from your own bone marrow, and you're actually doing it for joints, for regenerative, for ortho, okay? So those have been FDA approved. Now, everyone's talking about embryonic stem cells. Those are not FDA approved, right? Are they being done and researched and explored outside of the United States? Absolutely. Have they seen potential benefits of them? Yes. But also, too, even here in the U.S., there is talk from the big academic universities about also they're looking into as far as researching whether stem cells or exosomes can be programmed, because don't forget, too, you have to be careful with what is being used and what message is being delivered, because we all have what we call dormant cancer cells, right? You don't want to be waking up the wrong, right? You don't want to be waking up the wrong cells. And also it has a lot to do with our immune system, which brings us to the whole world of functional regenerative, right? If your immune system is healthy enough, because they did trials and studies in Japan or one of the Far East countries about why is it that some people get cancer and some people never get cancer regardless of the lifestyle, and has a lot to do with your immune system. Okay? When you have a good, healthy immune system and a cancer cell wakes up, your immune system knows to suppress that cell or attack that cell as opposed to let it grow. Okay? If your immune system is weakened, then your body doesn't fight it off. It's just like a virus or any kind of an infection. All right? This is where our immune system is very key. So our own body has the ability to repair itself, but we just are not utilizing it in the right way. And I think this is where the functional regenerative integrative medicine comes in.
I agree. And I'm so glad that we're paying attention to it and more people are getting involved in it. Epigenetics, that's a big part.
Epigenetics is a very big part.
We're realizing that it's our environmental connections to the tops of our cells or the outside of our cells that trigger, am I right? They'll trigger like our environment or what we eat can actually cause your cell to wake up and trigger not good things as well.
And the thing
Putting
is,
it in simplest terms.
right, and with epigenetics, it's literally how the environment, without changing your DNA, can actually affect certain things in our, how we manifest certain things, how certain things transform, for good or bad. Because we know, and all the literature and data that's coming out now, just like the whole big hype about microplastics and plastic water bottles and so forth. And this is why a lot of countries have done away with the plastic water bottles. Everyone's using glass. But unfortunately, too, it depends where you're sourcing your water from. Is the water contaminated? Is it hard water? Does it have minerals in it? Does it have certain other pollutants? Those are the problems too, because if we are doing, which most people don't do, so like for example, when I do a heavy metal or mycotoxin test for my patients for functional medicine, you'd be surprised about some of the toxins that we all have, even on my own self. I mean, I do my own tests as well. And you'd be like, oh my God, how did you retain that? Well, it's the exposure. Even some of the things we inhale, even some of the things, whether it's in your work environment, your home environment, and so forth. And it doesn't matter as much as people say, oh, my home is pure air. Well, you're still getting pollutants and toxins in there, okay? The other thing is the pesticides that we're ingesting, right? And that is changing our gut microbiome as well. It's affecting our gut microbiome. And then we're getting leaky gut syndrome. We also talk about a plethora of things about early cognitive decline, dementia, Alzheimer's, Parkinson's. And now one of the newest studies that came out of Alzheimer's is also that it's considered, used to be about amyloid plaque and the beta amyloid. Now the whole big new thing is about, it's an autoimmune situation just because of the toxins and the bacteria, and the body doesn't know how to fight it, and the brain cells. There's a lot.
There's a lot.
Huge
Microbiome has
yes.
been attributed to this.
So this is the reason.
It's appearing that it can be something that can be given to, it's in your genes.
Well, the thing is genetically.
Because of the
Right, the microbiomes. And the thing is genetically, that's why too, for a while, everyone's getting tested for the ApoE, right, gene to decide if they have the propensity for Alzheimer's or not. But then there's a lot of other factors, like the epigenetics that comes into play. Because why is it that also somebody may have a genetic component but never manifest Alzheimer's?
Yeah.
And there are some people who don't have a family history, same thing with breast cancer, with all the different types of cancers. Just like also too, people are saying, we're seeing an increase of pancreatic cancer, but we're not really sure what causes the pancreatic cancer. So at the end of the day,
person that smokes their whole life
right.
and doesn't get lung cancer.
Right, exactly.
Versus the person that never smoked and dies of a lung cancer.
So there is a lot of unanswered questions. Yeah. There's a lot to still delve into, to research. And this is where trials, FDA research comes into play. And this is why, hopefully one day we'll be able to program, whether it's exosomes, stem cells, to be able to suppress all these cancer cells, all of these, whether it's Alzheimer's, Parkinson's, turn that off and be able to...
Without turning something else on.
Correct.
Is what you're saying.
Yes, absolutely.
And that's going to take some time.
Yes, but I'm being hopeful.
Yeah. Let's be hopeful. I like being
hopeful. You have to be optimistic and hopeful that we're going to be able to find the answers and the cures one day.
Hi, everybody. This episode is sponsored by Pretty Girl Cosmeceuticals. These products are the best. If you're not using them, you need to use them. You can contact JKH Aesthetics anytime, and we will give you a consultation about how to use these amazing products. We have Glow Girl and Ice Drops. These will keep you young, healthy, and glowing every day of the week. And now, back to the episode. Speak to polynucleotides. Because they are becoming quite the rage. They're being used a lot in Korea and other countries, like everything else. I don't know. What do you think?
So it's interesting that you asked about that. Just like the word exosomes became a buzzword.
Yeah, I know.
First it was stem cells. Now it's exosomes. Now it's PDRN.
Yes.
So PDRN became the biggest craze because of the Kardashians' salmon sperm facial. Okay? And it is so funny because polyribonucleotides have been around forever, just like GLP-1s and peptides. And it's funny how things get certain attraction and attention. And I also kind of say that some of my colleagues like to create some media hype sometimes, even though we know this stuff has been old, it's nothing new. So I'm not one of those people who jumps up and down and stuff. I've been aware of polyribonucleotides forever, just like when PDO threads came out. PDO threads back in the day were not a fan favorite because at the end of the day, what happened? They had that contour lift or the feather lift or whatever. People had complications. Yeah. The threads migrated to the surface. They were not dissolvable. So they went off the market and were not approved. And then they came back to the U.S. so many years later with the absorbable PDO, Where we know in Korea and other countries in Europe, PDO threads have been used for over 35 years. They're suture material that we've been using in surgery. And when people ask, oh my God, am I going to have an allergic reaction? I'm like, it's not immunogenic. I mean, if you've had surgery before, it depends on what the suture material that was used in the past, which they don't use anymore because people can get actually reactions to. Same thing when we're going to talk about with sculpture and radius, and we'll get to that later. But not to confuse the issue, PDRN, which is a salmon sperm or trout, okay, is a polyribonucleotide. It is a micronutrient, okay? Now, why was it a big hype to use it with a facial and whether you're doing microneedling or not? And as you and I both know, microneedling in the hands of estheticians can be what? How many millimeter depth? 0.25, right? So you're not breaking the stratum corneum. Now, we also know that there are some people who buy their own microneedling tools and kits and do it at home, and then they abrade their skin. So anything that you abrade the skin is going to allow, whether it's your skincare product, your vitamin C, anything, to absorb your product. So the problem is that people are saying, oh my God, is it legal or illegal to do PDRN? Well, at the end of the day, you can get a product that's over the counter that's going to say it has polyribonucleotides, but you don't know if it truly is or not, or you can get the medical grade. Now, if you're doing an exfoliant or if you're doing anything applying it topically, that's not illegal, okay? Now, the thing is that none of them have been approved to be injected, okay? So according to FDA...
They're selling them to estheticians, though, with like in a syringe, I've noticed at the shows.
Oh, I haven't seen that.
Yeah.
Really?
Yeah.
In syringes. I've seen them in vials and bottles.
Bottles.
Yes.
Both. I've seen them.
Okay.
But recently I'm seeing them being sold.
Interesting. And I wonder because the other thing too, I haven't seen every single brand, but I know the reputable brands, they're selling it in vials and bottles. And also people have microneedling pens or the microneedling stampers or rollers, which is interesting because years ago, the microneedling roller became available to the public. And I was like, do we really want people at home taking a roller to their face with these needles that are not going to be sterile or clean? And what kind of infection are they going to get in their skin? I don't know. But you know what? People proceed with whatever they want to do. So obviously the FDA is not going to go crack down on people in their homes. No. Okay. The thing is that when it comes to the polymicronutrients, whether you, just like for a while, I don't know if you remember back in the day, people were injecting vitamin C into the skin.
Yes.
Or they were microneedling and then developing nodules. Well, vitamin C serum is not made to be injected, okay?
Nope.
So you could say the same thing about PDRN. Yeah. Now, are the companies that are reputable getting FDA clearances or approvals in order for injections? Some of them are, just like when you have to get approval for a filler, okay?
Yeah.
Now, the ones that are on the market right now currently, which are reputable product brands, okay, and I can name a few of those and the ones that I personally use, okay, those products actually are approved for topical. They're cosmeceutical, okay? They're not pharmaceutical. So that's the difference. Now, that means you could do the microneedling or you could do an exfoliant or you could do, like some people say, oh, if you do a laser peel. Well, also, you have to understand the micron depth you're going. This is why when people say, oh, it's a drug delivery. Well, if you don't understand the dermatology, skin Fitzpatrick, skin layers, depths, then you really shouldn't be doing these procedures. And this is what's going to determine if you are following guidelines or not.
Yes. So true. So true.
One of the big things when I train people on laser physics, skin microbiome, these skin layers, depth, Fitzpatrick's, that is very important. I find that so many people don't really know the difference. They're just like, oh, I'm just going to microneedle this in. And like, well, what depth are you going? You know? And plus, you do know that estheticians, like I said, can't go beyond 0.25.
Right. If they're, I think in California, they're not even allowed to do that unless it's recently changed. But, and I know in others, like Florida, is that what it's like in Florida?
Yes.
Some states, they can do whatever they want.
Right.
But we live in a stricter states.
And
Florida,
that's why everyone has to follow whatever state they live in.
Yes. You need to be in control of your own destiny and your own license.
Right, absolutely.
And don't listen to what they say on social media or somebody that tells you, a friend tells you. Seeing that a lot with SDs here. Estheticians are reaching out to me. Do you know anybody that can certify me for my... Nobody. So if a company's certifying someone in California, that's illegal. That company shouldn't be doing that.
Correct.
But they are. They're selling these poor estheticians, their $3,000 pins and training them, and then they're complaining that they get in trouble.
Right.
But back to nurses, the same thing. Like, you need to know what you're allowed to do and be within your scope.
Absolutely. Just like you also just said it. People, when you said about taking a weekend course and becoming an expert, no weekend course is going to make anybody an expert in functional regenerative or aesthetics. And anybody that claims that they're certifying you, there is no board certification for these. I mean, everyone can claim that they're giving you a board certification. This is not a board certification. Okay? No. You can have a, training and you have a completion, certificate of completion, just like when you attend a conference. It's a class, it's a workshop, it's to get the hands on. But none of them are going to be board certified. So that's one fallacy that you have to delete
the certification.
Completely. Correct. Key. Board certification means that you're an internist. Yes. You're a plastic surgeon.
Yes.
You're an anesthesiologist. You're a pediatrician. That's board certification. Whether you're in some subspecialty and you've gone through the boards.
You hear that? And I hope everybody hears that because it's up to you to ask the question and find out.
Right.
And don't just listen to what you want to hear. And I know it's easy to do that because everybody wants to make $1. Oh. But you're dealing with patients and you're dealing with your future. You're dealing with your life, what you do for your livelihood. And you don't want to do something that could ultimately destroy your family, yourself, or, gosh forbid, a patient. So,
right. And we see and hear so many horror stories on the news about somebody that shouldn't have been doing liposuction that was doing liposuction and they didn't even know the anatomy of it and the patient died. And I was like, why would that person be doing that? I mean, why would you even take that risk on somebody else's life when you do not know? It's not about being cavalier. It's not about making a fast dollar because that's the end of your career. And that's the end of the patient, unfortunately.
End of the patient. And then you never will be able to fall asleep at night because I'm sure that wasn't the intention, but that's what happens when we keep our blinders on and don't pay attention to what
same thing that happened, remember, with the whole IV lounges?
Oh, yeah.
Oh, my gosh. That's a whole nother topic.
That is. They're cracking down on that here, too,
well,
as they
because
should.
Everyone and anyone's opening up an IV lounge and just either giving pure LR or saline through the IVs and charging them. As a nurse,
we don't even hang a bag of anything until labs are ran.
Right.
So that's not happening. And it needed to be cracked down on, and I'm glad that it is because most people would think nothing of going in the next morning after they drank or they didn't feel well. They were taking their children in. People were taking their children in with colds and getting them.
IVs.
Yeah, at 12 and 10 years old because they wanted them to feel better. With Zofran for their, because they're nauseated. So I could go.
I know.
That's a podcast.
You and I can definitely go on and on about
because we just want to help everybody stay in their lane and not harm anybody else. We don't want anybody to get in trouble.
Right.
And we also want to level ourselves up.
Yes.
And we want to stay high-functioning practitioners and follow guidelines.
Absolutely. And I think also this is the other thing too. When we have our industry well-educated, abiding by rules and regulations, that's not going to then create more issues for the FDA. And if you create less issues, then the FDA is less likely to be scrutinizing so much and trying to crack down on so much because then they see that everybody's following the rules. Whereas also when there's potential of certain companies that whether they're approved in Europe or other countries and they're trying to get FDA approval, when people bring those things here before they get FDA approval and start using them and start spreading bad information on social media, it is going to make the FDA not want to approve these things. Yes. And it's going to keep us behind the times, unfortunately. So I feel like it actually is a negative for us, even as practitioners, by trying to spread wrong misinformation.
Especially in the field. The functional medicine field and aesthetics were last on their list.
Right.
So there's so many other problems that we have with people's health and cancer. We have Alzheimer's right now, Parkinson's, all these highlighted issues that they're focusing on, and as they should be. Okay, I'm going to keep moving on here. Let's see here. We talked about, we're not even going to get to that because GLP-1s, I mean, I got to get your opinion on this. Okay, so these have been around forever. Big Pharma didn't come up with GLP-1 semaglutide. They came up with the pen, though, and that's what they got FDA approved. When I've done a deep dive, I'm pretty sure. Would you agree with me?
The Ozempic pen and the Wegovy.
And the pen is actually what they have their patent on, and why that's so expensive. But you can get them sourced appropriately with the right functional doctor. And I believe it really needs to be somebody educated, because I think we possibly could be dosing people too high with these baseline
I think one of the big
doses.
challenges and issues too is also, as you know, and this is why the FDA also was cracking down on some compounding pharmacies. Once again, I think a lot of people as practitioners are also partly guilty for creating the issues, right? Why? Once GLP-1s became popular, everyone started trying to figure out, oh, how do I get it? How do I get it? And also, especially because we know that in the celebrity world, once one person does thing, whether it's, one group or another, or a particular celeb,
Kardashians,
right,
they start everything.
right, everybody jumps on that, and then it became an issue because now everybody goes to their doctor and it's like, oh, I want the same thing. I want a quick weight loss. Well, number one, the first thing I said to my patients, there is no magic wand. There is no quick fix. And if you are going to go on this journey, I need you to do behavior modification, diet modification, exercise modification, or I am not going to be actually even going down that road with you. And I have to explain to you what it is, pros, cons, side effects, risks, and benefits, okay? We know that GLP-1s as a peptide have been around forever. We do know that they have other benefits from a cardiac
remarkable.
and lipid stand profile,
They're
right?
remarkable.
The question and the problem that became an issue is what? How, like you just said, are being dosed or overdosed. How people were losing weight too fast. That's when we got into the whole thing about Ozempic face, Ozempic body, Ozempic butt, Ozempic this, Ozempic that. And now there is some questionability about, Ozempic is also affecting the adipocytes or the actual fat cells, and it's causing premature aging. Not enough studies have been done about that to show the cause and the effects relationship, but of course people are drawing those conclusions.
Any rapid weight loss is going to cause
Correct. Now, what we haven't looked at yet is is it affecting your type 1 and 3 collagen? Is it affecting your elastin? Okay? Those are things that we take a look at. But at the same time, one of the things that I tell my patients, right, if you are on these medications, whether because you're diabetic, your endocrinologist put you on it, or whether you're doing weight loss or you're doing it for functional health benefits, what you might want to do is definitely eat healthy. You want to exercise. Focus on building muscle mass so you don't lose muscle mass, right?
muscles, everything.
Stimulate your skin. Go get professional treatments to stimulate your type 1, your type 3 collagen, your elastin, so you're not losing. Because we are losing it after the age of 25 anyways, right? As soon as you hit 25, people used to think it was 35. Now it's after the age of 25. Whether it's photo damage, epigenetics, lifestyle, diet, our elastin and collagen does get depleted. And this is what makes the difference between somebody who ages gracefully and more youthful than someone who just is a sun worshiper, and now they have all the photo damage in the world, and now they have reptile alligator skin. You know, there's so many factors that go into it. So my thing is to them, okay, if you stimulate the skin, you do good nutrition, you're treating the gut microbiome, the skin microbiome, you're doing stimulatory, whether it's the micronutrients, whether you're doing PRFM, PRF, whether you're doing microneedling, laser resurfacing, all of those things, energy-based devices, right, which are going to also stimulate, whether you're using Sculptra, or whether you're using hyperdilute radius, because we do know that hyperdilute radius stimulates collagen type 1 and 3, right? It's
and
great for the skin. And elastin,
right?
Exactly, absolutely.
Sculptra doesn't.
Sculptra
Just
is
one.
a type 1, and it's also volumization, because you know that's what it was originally developed for. So there's room for both to be used, right, for the right patient, right indication. And this is why I tell people, not everything is for the same indication. And sometimes you need multiple things, right? In order to address, it's almost like the different layers of the skin. You have to know what you're doing. You have to know, do I need an energy-based device? Do I need RF? Do I need microneedling? Do I need PRF, PRFM? And some people don't even know the difference between PRF and PRFM,
No, they don't.
right? And these are the things that we have to educate the general public as well as our own peers. And these are why these conferences are great for that. When we get all these new lectures. And as you notice now, a lot of the conferences are focusing on the regenerative, functional, aesthetic aspect and tracks, which was not there before.
No, this is all new and it's very exciting. I'm so excited.
And I'm loving it.
Oh, I know you are. It's like your favorite spot. It is mine too. I'm so excited. Okay, so quickly, let's talk about the decline in injectables. Have you seen it? And do you think, I mean, there is a study. I have the study. We'll post it on the clip right here. They'll clip away to it. There is a study out that shows a global decline on both neuromodulator and injectables. Could you and I be hopeful to think that's because there's all these wonderful regenerative options out there for people and they're using to spend their money on those things as well?
So in my practices, because I also have never been so big on the overfilled pillow face,
Yeah.
and I've always deterred my patients from that, even though they beg for it sometimes, and now a lot of them are coming back and wanting to get dissolved from other practices. So I think one of the big things is the decline that we're seeing. That's true. Less and less fillers. People are not wanting fillers as much. Okay. Because there are other options. There's the energy-based devices. There's the polymicronutrients. There's the PRF, PRFM. There's the Sculptra, the Radius. There are other options, and you can integrate all of that together to give an ideal natural result. Just like, for example, for a while, everyone was getting breast augmentation, right, and implants, and then everybody was going into the explant world. And now they're trying to do minimally invasive other procedures for natural augmentation. So what we're seeing is people are trying to go more towards the natural, healthier trends, which I think is fantastic.
Yeah,
right?
I think it's great.
Because if you focus on skincare, okay, and I tell this to my patients, even when moms come in and they have their teenage daughters or their daughters are going to college, I'm like, they all come in, they're like, oh, I want lip filler. I'm like, okay, before we start focusing on lip filler, I think the first thing we need to do is create a skincare regimen.
Yes.
That is one of the first things I do. And I treat a lot of also adult and teenage acne patients, okay, and acne scars. And of course, I take a look at their labs, I take a look at their nutrition, and then we go from there. And I create a skincare regimen for them. Because even my nephews, I started them at a very young age, and they're boys, my brother's kids, on skincare, and they have flawless skin. And I'm so proud of it. And everyone laughs because they're like, oh, yeah, well, look who your aunt is.
Yeah.
I'm like, yeah. You need
bonus.
to have flawless skin.
You need to have
Boy or
flawless,
girl.
boy or girl. Especially boys, they're very into, young men are
Exactly.
very into taking care of themselves
Yes,
this
which
day,
is fantastic.
which is fantastic. I love that.
My patient population of patients is actually almost 50-50 male-female.
Oh, you're pretty good. Yeah, mine's not that much. It with young men it is though. Young men.
I have of all age groups, which is interesting.
That's good.
Yeah. And
You
it's
also do hair. A lot of hair PRFM and exosomes.
Yes.
And you get great results, don't you? Especially with that PRFM
Yes.
or
And
PRF.
PRFM.
PRFM.
Patients,
it's
because the
huge.
PRF is more of the gel
Yes.
pot, so that doesn't like absorb into. And then I order their labs. I make sure I check their hormones. I check their thyroid, male or female, just to make sure that everything's balanced.
What if their testosterone? I'm sure you check that.
I check I have certain profiles that I have my office order on my patients as baseline labs. I take a look and see what their underlying issue to find out why are they losing hair? Why is their hair thinning? Is it their diet? Is it their hormones? Is it their thyroid? Okay, because male and female have
Do
different
they do
underlying
better
issues.
if they have a higher testosterone?
Well,
or they have-
testosterone, if it's too high, you'll shed
younger?
hair.
If
If you're too high, you
shed-
share.
you
And
shed-
also you have
yeah.
to take a look at also DHT, because this is why
DHT.
some people get
That's
a
where I
DHT
was
blocker.
going, DHT.
Because if the DHT is high,
Okay.
right, then this is why it blocks the follicles, and then they lose the hair. So the thing is for me is, how do we stimulate the follicle? How do we stimulate the dormant cells, the follicles that are there? If the follicle's gone, you're not going to
There's
restore it. You need to
nothing's
do
gonna
hair
happen.
transplant.
Okay.
Okay. I mean, and I tell that to my patients. That's why you have to do a proper trichoscopy analysis of the scalp. You need to assess to make sure they don't have a dermatitis. They don't have any kind of underlying scalp condition that is causing the hair follicles to actually die or shed the hair. You also have to understand and see what are the shaft size. So I do a whole imaging process
This
besides
is
the
totally
labs.
different than what people are going out to get. They're going out.
Correct.
So
I think most people, and from what my patients have told me, because I always ask also, have you had other treatments? What have you tried? What has worked? What hasn't worked? And when I was working on doing a hair trial, one of the big things is that I made sure that the patients that we actually, our criteria, patients had not been having any PRP injections for the past year. They're not on any kind of topical or PO supplements
Okay.
for the hair growth. If they're on hormones, I don't make them stop their hormones. I don't stop any prescription meds, but I do check their labs. And then we go from there, and I treat them and see what the results
that
are.
may have been a lot of why people were lacking success with their hair growth treatments, doing the 4 or 5 series of PRP and having patients necessarily not being happy because there's so much more involved. Is what you like. Get in there and do that baseline assessment. Get some labs. Let's find out what's going on so we can balance that out before we go in with the treatment. And PRFM is what you're using
Right.
for. Are you doing that solely, or are you doing that with PRP still, or have you moved onto PRFM? It's faster, isn't it?
PRFM has more growth factors than the PRP, as we all know. Plus, PRP is more inflammatory, which we need anti-inflammatory. And that's where the actual exosomes, when you add that with that, it decreases inflammation, cytokine release, and all of that. The other thing, too, it has also growth factors, as you know. One of the other things, too, as you know, some of the serums and the shampoos and stuff are going to have GHCKU, which we know is a peptide. The copper peptide is great for hair and skin. So those are things that I also have my patients as far as shampoo and conditioner. I put them on a certain regimen. I also recommend for them to get the red light cap therapy that they can purchase and buy and use on a daily basis, because you're increasing vasodilatation, you're increasing blood flow, and allowing the micronutrients to absorb into the scalp. So these are all important things, whether it's the shampoo, the conditioner, the nutrition, everything, even sun exposure, right? Because you get photo damage. Most people don't realize that their scalp gets also photo damage. People think, oh, what the heck, right? No, that's not true. So those things you have to take into consideration, male or female, right? And then I've gotten fantastic results where I've been able to get those results for my patients in 2 or 3 sessions, as opposed to, and that was one of the big things that I always like to find a solution for a problem, is that when patients said to me, oh, I got 6 to 10 treatments and the results were okay, or I didn't get any results, I'm like, well, number one, most patients don't have the time, interest, or want to spend money to be coming back 6 to 10 times, right?
Yeah.
So if I can find treatments and solutions and options for my patients where I can get them to their endpoint in 2 to 3 sessions, then
That's incredible.
They can focus on also now their budget and their time on other treatments from head to toe. I've had people say to me, aren't you worried that once you finish all those treatments for them, they're never coming back? And I'm like, well, number one, it's not about the dollar. And number two, they're going to be wanting to come back for other treatments anyways. But if you keep doing 6 to 10, they're never going to have enough time or money to keep trying to explore other treatments and other options out there.
Yeah, work on their face and not just their gorgeous head of hair.
Exactly.
There's a lot to people. I get those questions all the time, and I don't do that here, and there's a reason, because it's specialty related. I really think it's a very specialized area, and you've nailed it. So you should do a course. You probably do. Just add another thing to your list. We'll start a course. She's going to have a course, and we're all going to sign up.
I'm happy to train people. I do private preceptorships. I do offer training. So as you know, that's the thing. And also I share my protocols with people. I'm happy
Real quick before we move on, is that how do you keep the pain down for the patient? Because I know there's some pain involved.
For hair restoration?
Hair restoration.
So I also do what we call, my treatments are laser treatments for the hair.
Okay. So you like an RF?
No.
Okay.
I do, okay. So without naming a name brand.
Oh, yeah. Okay.
I use a particular laser which actually increases the vasodilatation to the area of the hair. It actually was created in order to help stimulate, and it was created originally for the face, and I found that it was also helpful for the hair, and it's similar to the LED red light cap therapy, and it allows the nutrients to be absorbed into the scalp, and it stimulates hair growth. And it doesn't hurt.
It doesn't hurt.
No.
So
but you could do numbing as well if patients feel like, because most people are injecting, or they're doing when they're doing PRP, they're injecting, or they're doing microneedling, and people do topical numbing, or they do ring blocks.
Okay. I figured that would be the only other alternative. That's very interesting. Thanks for sharing that. She has all the answers. Okay.
I wish I did.
We're gonna wrap it up with social media. As you and I spoke earlier, we said, when we started out years ago, before there was all this, I used to do advertorials in magazines and send out mailers. That was our outreach. And now there's social media. I've just recently experienced a bad situation with social media and how toxic it can be. It wasn't directed at me. It was actually directed at a guest. And I've never thought it was really possible. Have you ever experienced retaliation or hateful things, or do you just compartmentalize it and set it aside? How do you handle that? And have you had that? Or somebody doesn't agree with you, or they dismiss you, or call you names, or...
So number one, a couple of things with my social media. I don't get too wrapped up on it. I don't focus on it too much. I do have social media managers that handle my social media. And I have always told them my social media page and IG is to stay completely professional, to showcase treatments and results, and to be able to answer any questions people have. It is not to be political. It is not to actually badmouth anybody else. It's not to comment on other people. If somebody has a question they want to reach out through a DM and they want to have a private conversation, I'm happy to do that. So that's one way to avert all of that. Number two, listen, everybody has their own way of doing their social media. Some things are very professionally done, some things are not. Do I see my colleagues, some that are unprofessional, some are professional? Yes. Do I comment on that? No. You know what? I say live and let live, and to each is his own. So I don't really delve into that space. And like I said, stay in your lane, be respectful, be mindful. I think the animosity, hate, or like you said, retaliation, it's unnecessary. Why? What is the point of that? And what are you achieving unless you have your own issues, okay? And if you have your own issues, or if you have an issue with a particular person, then take them aside or have that conversation as an adult, as a professional. I mean, that's basically my thought process.
Right. And I agree. And I believe that social media should be a place for professionalism, just like in our office.
Yes.
And I get it, though. Everybody's trying to get the attention or build their business through this like and follower situation. But
unfortunately, here's the problem with all of that. Even with people saying, oh, they have so many likes or so many followers, who cares? Okay? I mean, do you think people are looking at that? I know for a while, because social media was supposed to be a moneymaker for people. Okay, that's great. Or TikTok or whatever, YouTube channels. That's fantastic. Now, though, I have great respect for colleagues of mine that have used those channels and avenues to educate people or to showcase wow results, wow treatments, not to get out there and badmouth other people and not to get out there and even critique some celebrities as we've seen.
Yeah,
okay?
there's
a lot of that.
Yeah, like you show the side-by-side picture of like what they've had done, and they explain it. And
I never even get involved with commentaries on that. I don't even bother, like when everybody says, oh, that's the trend. And that's the other thing too I've noticed. When one person posts one thing that's a trend, everybody on IG now does the same trend. And I'm like, okay, that's getting old.
It is. But should we be educating on there?
Yes, absolutely.
Okay.
I think so, because don't forget, with social media, you have a general audience, a professional, and the average consumer. And consumers are big on whether it's Facebook, social media, IG. Some consumers are on TikTok, depending on the age group, of course, right? Gen Z versus millennials versus baby boomers. I think if you educate those, that's great, and you're sharing knowledge and information because they're looking for that. Those are the people that are looking for that. I think us as professionals, you should be going to conferences.
Professionals should hold this all up to a higher standard.
Correct.
And teach our youth through that. Our young, wonderful providers that are coming up in the world on the social media.
Absolutely.
And show them what it's like to lead by example through these networks of media. So thank you so much for being here.
Thank you. This is
my
wonderful.
Gosh.
Thank you.
We have so much more. I have a list. And we could just keep going and going. So
I know, but it's always fantastic.
You're
thank you, Jerry.
so cool. I'm so glad we met in Vegas.
Yes.
And we are kind of local. I'm going to come check out your place.
Yes, you should.
I am.
Absolutely.
I'm going to come check out one day when you do hair down there.
Okay,
I'm gonna come down there and
absolutely.
check it
Yes.
out. And I'll let you guys all know how amazing it is. So at the end, we always do a champagne toast.
Fantastic.
Even if you don't drink, you can pretend. Thank you, my dear. You're awesome.
Thank you. Cheers.
Cheers. It's going to be a great episode. I'm glad you guys were here. See y'all later, outlaws. Like and subscribe to the channel. Ozza, tell them, like and subscribe to the channel.
Absolutely. Right here. Come on,
beauty
everybody. Yes. She's the bomb.
Peace out, everybody.